I would now like to ask up another medical advisor from the ITP Support Association, Dr. Nichola Cooper from Hammersmith Hospital, and Nikki will be talking about the management of ITP with teenagers and young adults.
Hi. So you've had, I think letting you know what it's like to be at medical school. You've had an immunology lecture. You've had a pharmacology lecture. And now I'm going to do some neuroscience. So I hope you've had a lot of, you've got a lot of sugar on board. So the teenage brain. I mean, how many of you are looking after children with ITP, or how many of you are children with ITP? Okay. And for the rest of you, you have children, nieces, nephews, grandchildren, whatever. So I thought this was a useful little talk to go through. It's something around I found very useful when I went to a teen and young adults lecture course. And so I asked a friend of mine who was a psychologist looking after adolescents with more complex psychological problems. So I've tried to learn this, and I'll try and teach you this. Here's your brain. Obviously, it's really complicated. There's a lot of things it has to do in order for us to all function, actually. And there's different bits of the brain. There's the frontal brain, occipital brain, parietal, temporal lobe. And those are the things we have to learn as medical students, all these weird words that are Latin. And this is really complicated, and I'll try and explain it to you. So when you've had your first... Let me get this. So you're seeing something for the first time. This is called a sensory input. If you're attending to it, you're understanding that's happening, you start to process it and it goes into your short-term memory, and then you can process that and goes into your long-term memory. If you don't attend it, you lose that information, okay? This is all about synapses, something called synapses, a neuron telling another neuron what to do, and it has to learn what to do because it's seen something before, a bit like those immunology cells as well. If you see it enough times, you become a neuron that works functionally and understands what to do. So this is the kind of thing that's going on in your children's and your adolescent's brain the whole time, learning about your environment and what's important and what's not important. So there's a lot going on there. There's two bits to that, two main, we can divide it into a lower and higher region. So your lower regions are the kind of things that, men are always doing, just breathing, not much else. But the higher regions that the women are always doing are the kind of complicated frontal lobe, where you're actually having to think about things, you're doing tasks, you're aware of your environment, everything else that's going on, looking after the children, while the men are just breathing. And you'll recognize this one too. Here's your neocortex, the rational thinking brain, again, really big in women. Reptilian brain, instinctual or dinosaur brain, you know what I'm talking about there. And then you'll recognize this one, your limbic brain, your emotional or feeling brains. And that's the bit that expands in adolescence, really. So that starts taking over more of your emotional brain. And what I'll show you in a few other slides is there's a development of your brain that is a little bit that doesn't work in harmony with each other as an adolescence. So you've got two big parts of the brain, two parts of sudden expansion of the brain. So it significantly develops in infancy, but then in adolescence, it then goes through a second process. So obviously, as a newborn, you have to understand your environment. You're starting to learn to talk. You're starting to learn to walk. And your kind of cerebellum, visual cortex, these parts of the brain are really important. Your infant is rapidly progressing. So by the age of 2, their brain is about 75% of the adult weight. So during those first 4 or 5 years, there's a rapid increase in the brain size. They're making a lot more of those connections. That's what they're doing all the time. They're having to work out what's going on, what they should be doing. It's much more straightforward. And then what happens in adolescence? So suddenly they get lots and lots of hormones, and then suddenly all these things are changing. Okay, so they've got their thymus is changing, their ovaries or testes are changing, the hypothalamus is changing, these different hormones, and that's all affecting the brain and changing it. Another really important part of this process is this carries on until 25. So, and actually in medicine, we're now not just saying teenagers, teen and young adults. So the period up to 25 is physiologically in your brain as well as emotions is important. So that's an important part of this kind of transition process. And transition process from children to adults is done really well in lots of cancer specialties, but is not done well in rare diseases and is not done well in ITP, for example. So that's something that we're really keen to work with you a bit more on. So the key task of the adolescent brain is pruning. So you actually get rid of lots of neurons which are useless and you reinforce the ones that are useful. I don't really understand how they decide this process, whether that's an individual decision. I don't want that. Do you want that? Obviously, that's quite complicated. I don't understand all of this either. This is kind of neuroscience, which is another complete other specialty. But importantly, so the first to be pruned, so the first part of the work is done this bit here. And the last bit to be pruned is the frontal lobe. So the changes are happening around here, around the sort of dinosaur brain, the emotional brain, but it's not until much later that these frontal neurons are changing. So this is what's happening to the teenage brain. This amygdala, this central emotional brain, this is what changes first, and the hormones are affecting this bit here. So, that's why they might become more emotional or irrational, because actually the frontal cortex is still undergoing their development to take control of the amygdala. I was also told that boys take longer than girls, perhaps. And really? And this, I'll let you decide for yourself. So the region that develops last in adolescence is important for rational thinking, controlling behavior, personality, making sense or inhibiting emotions, all other perceptions to decide behavior. So, actually, and finally, all these hormones that are expanding, you're getting a more active, this amygdala lizard brain part. So the influence of emotions are much stronger than your thought kind of processes. So the key point is that adolescents and young adults, all the way up to 25, are actually dealing with a lot of uncontrollable changes at that time. They're having to, and at that same time as they're going through this emotional and mental stress, they're also having to become more independent and understand how to manage their ITP and the medications during this time. And finally, they're having to deal with their parents as well. And actually, one of the work that we've been doing, so Alice Hart, one of the clinical fellows in my lab, has been looking at MRI brains in children and adolescents with ITP and health-related quality of life. And the more the health-related quality of life affects the child, the more the health-related quality of life affects the parent. And another bit of work we've done is we did some patient days we had a child patient, pediatric patient day, and Alice just left some cards around for children to write what their concerns were. One of their big concerns, a lot of their concerns is about their parents. So they're anxious about you too. They don't want to worry you, and they don't want to show you that they're upset too. So those are things that are going on in the background. And then back to those little neurotransmitters here. So I thought actually what I finished on is trying to think about the ways we can perhaps help actually. So this sort of neuron to neuron network that's happening in infancy and then changing and pruning in adolescence. One of those transmitters is something called serotonin, which I'm sure you've probably heard about. And I think these things, so leafy green vegetables, all the things that teenagers don't want to eat, walnuts, oats, smiling a lot, which none of them do, eating greens, almonds, and walking, exercise, really crucial. And these kind of things can improve your serotonin. So I think there are simple things that are not too difficult, hopefully, to change, that will help you to actually have a happier child. I think sort of a healthy diet, not an obsession about diet, but a healthy diet is really important, and exercise is really crucial. And I guess the things that I've sort of thought about in looking after adolescents with ITP, the things that they struggle with, taking medications is a huge problem, and there's definitely a change in teenagers suddenly losing their response to Eltrombopag, particularly during the half-term, holiday time, half-term. They suddenly stop, their platelet counts drop, and they've stopped responding. And that's a big issue for Eltrombopag because of the food restrictions. They can't really go for 4 hours without eating. That just doesn't happen. And you're no longer in control of the food either. So they might tell you they haven't drunk any milk. They might tell you they haven't had any calcium-containing products, but they've just eaten chocolate all the way through the day. And that is something that happens all the time. Certainly we find if you actually ask children above 12, if you offer them an injection once a week or a tablet once a day with food restrictions, most of them choose an injection once a week. It's like once a week, they don't have to worry about it again. So that's a big issue for kids, actually. Coming to hospital, having bloods done, they obviously hate coming to hospital. Time off school for hospital visits or for bleeds. And I think one of the things we've realised is that I think there's an unnecessary time off school because they've had a bit of a nosebleed. And one of the things our nurse works with is the schools, because what's not right is for a kid to be sent home every single time they've got a nosebleed. And there's often an over-exaggerated response by the school if you're not talking to them. Activities, anxiety and parental activity. I was really surprised. We had a Zoom patient day, and one of the things I didn't realise at all is that one of the 16-year-old had stopped. She always wanted to do paintballing, which she stopped for a few months, but now she's on treatment. Her platelet count's great. She's still not doing paintballing. Another of our 14-year-olds stopped doing taekwondo. He's now got a platelet count above 80. He's still not doing taekwondo. So don't forget all those things that you told them not to do, now they can do. And as you saw in that video, trampolining is a big thing. Not being able to trampoline, I think, is a big thing for kids, actually, isn't it? In the UK, one of the things we've tried to pilot, we don't have enough nurses to be able to do this properly. But what we would like to be able to get to the point of doing, we can't do this yet, is a process called Ready, Steady, Go. It was developed in Southampton, I think, where what we would get is the adult CNS specialist nurse come and talk to the teenagers at 12, 14 and 16, visit our adult centre at 16, and we transition at 18. Transition is really variable across the country. I think that's a really difficult time. There's a lot of discussion about when it should be. Because I look after kids and adults, I think 18 is a good time to transition, but I'd be really interested to see what Cindy thinks about that. I think 16 is too young. I think 18 is a good time to move, but I think that's something that needs further discussion. And what can we do? So important to be involved in activities, especially team sports. I think not being able to do team sports in that time is really, really critical to development. So I think not stopping teenagers from doing team sports, that's really crucial, making sure they're getting out, playing football, playing cricket, playing whatever it is they want to be doing trampolining. Really, there's very few things you can't do because of ITP. There might be a transient small period of time if you're avoiding treatment, not doing things, but getting back to activity is crucial. Working out strategies to taking your medication. How are you going to work out how to take your medicine? And certainly that's a huge, arguments between teenagers and their parents around taking medicine causes huge stress. Preparations for nosebleeds or periods. And one of my 16-year-olds has a little pack she takes with her wherever she goes, just a little pack in case she gets a nosebleed. Periods are something we always talk about. It's really easy to forget, and it's quite surprising how heavy periods can be. And they're often at that stage where they don't want to talk to their mum about it. They definitely don't want to talk to their dad about it. So, actually giving an opportunity to talk to a nurse or someone else about it. Patient Support Association, if you're not finding that locally, that support. So certainly I think the Patient Support Association is a really good place to go to if your consultant doesn't have time, because everyone is resource poor, unfortunately. don't let ITP stop you from achieving your goals. That's another thing. We've started to talk to sort of 16-year-olds. Where are you going next? What are you doing? Are you going to go to college? What are you going to do? And too many of them, I think, have shrunk down their sort of goals or life goals and are not going to go and do what they want to do. And that's really important. Parents, what can you do? You know, it does pass. They do get older, they do get better, and they do become kinder to you. And, you know, I think you have to be calm, really, and be, you know, keep just sort of being there when they need you. So, thank you very much.